Hello, webinar. Welcome to this webinar. Thank you for joining us today. I hope you can hear me loud and clear. I'm Michela Fassi, Communication Manager at Milestone, and I'll be your moderator for this webinar today. The topic today is frozen sections. We will see together which are the limitations of the current techniques, and together with our application specialist, we will see how we can implement strategies to improve the quality of your frozen sections. Before starting, I'd like to grab your attention on this slide. Here we show the Zoom platform through which we are broadcasting. The meeting controls hide and they are at the bottom of your screen. They hide if you don't use them, and they reappear if you move your mouse. Your microphone will be muted for the entire webinar. If you wish to contact me for any problem, please use the chat box. Also, this webinar is intended to be interactive, so we encourage you to ask as many questions as you want. You can type your question in the Q&A box, and we will answer all the questions at the end of the presentation. This webinar will be recorded and will last about 40 minutes. One final word about the speaker of today. Miriam is application specialist here in Milestone. She has been working here for 10 years and she has great experience in frozen sections and tissue processing. Now I think it's time to start, so I will give the floor to Miriam for her presentation. Miriam, you have the floor.
Thank you, Michela, and good morning, everyone. Today, it's my pleasure to speak about a frozen section in order to find together with you some solution to improve their quality. I would like to start with a very brief introduction. I'm sure that you already well know that frozen section is one of the most difficult procedures done in an anatomical laboratory, as well explained in the Rosai book. In fact, it is a urgent procedure that must be completed in a short time. It's usually requested without any notice, and nowadays, the conventional frozen section procedure allows to obtain a very poor quality that makes the diagnosis difficult and uncertain. Let's look at the image on the left. You can see that the general quality of the frozen section is poor. There are a lot of white areas created by ice crystals. The cells are squashed and the nuclear and cytoplasmic details are not well defined. My goal today is to achieve a quality like in the image on the right, that is similar to a paraffin section. Frozen section has some limitations. Apart from the difficulty of working at low temperatures, there is the formation of a lot of ice crystals that lower the quality. The short time available to make the diagnosis put a lot of pressures on the operator. It is difficult to orient the tissue correctly. And because there is not a cassette where to put the sample, the identification is not made or it is not accurate. Despite these difficulties, this procedure is extremely important. The diagnosis made on a frozen section gives the surgeon the right information to decide on how to continue an operation. The intraoperative examination also makes it possible to check the margin of a resection, reducing the need of a second operation that is costly in terms of both money, but also anxiety for the patient. The last important use of the frozen section is to check if an organ is good or not for the transplantation. Now let's see the procedure in details. Frozen section starts with the visual inspection of the fresh sample. Then it proceeds with the freezing and cutting of the sample, and then the staining of the slide. At the end, the slide is passed to a pathologist for the diagnosis under the microscope. Today, I would like to analyze this procedure step by step in order to identify the limitation and possible improvements on each step. Let's start with the first one, that is the gross evaluation. The gross evaluation is the visual inspection of a specimen, where the pathologist can touch, inspect, measure, and if necessary, gross the specimen. He can also determine its correct orientation, and it's possible to store information about the sample before its freezing. The ideal situation would be to have a grossing station with a cutting board under a fume hood, for safety of course, but also with a built-in camera to record video and take pictures of the sample, and a computer connected to the LIS to receive and upload information. Another ideal feature is the remote control of the grossing work. Imagine a big hospital with the anatomical pathology lab and nearby some satellite hospitals without pathologists. If an intraoperative examination is required in one of these small hospitals, a pathologist needs to travel to the small hospital to do the diagnosis, wasting time and resources. With a system that allows the pathologist to see the specimen in real time, but remotely, the pathologist can direct a technician to do this operation without having to travel. Beside this problem related to minor hospitals, in most cases, the actual situation for gross evaluation in frozen section is just a table and a requisition form with the specimen information. Although documentation at this stage can be essential to avoid error, mismatches between samples, and also for legal aspects, few pathologists have the tool to produce documentation in a fast and reliable way. Some pathologists have tried to use personal tools like cell phone that are not directly linked to the LIS. So there is the risk to mismatch between information of different patients, and there is also the risk of biohazard contamination of the tool. How we can improve the gross evaluation step? I have recorded a video to show you our approach to the grossing. I start the video. Okay. As explained, it is valuable to have a system for documenting the gross evaluation, which automatically stores the information of each case done. Using a high-performance camera with dedicated software like the MacroPath, it's possible to take a picture of the sample and add information on these pictures. If the sample is quite large and requires a grossing, it's also possible to record the video. Because the system is quite small, it's possible to put it under a fume hood for safety. Before to take pictures, I have to create a case folder with the case ID of the sample. So I read the requisition form and I create a folder specific for this case. Now I can take a picture and all the information, pictures that I take will be linked to this specific case. If I select a picture with this system, I can add information directly on the image. For example, I can measure the area of the sample or do its measurements. I can also add a text. In this case, in the video, I add a pre-written text that it's possible to set up. I can also use an arrow to indicate a point that is of main interest. All these information are automatically linked to this case ID. If a pathologist is not physically present in the laboratory to evaluate the system, he can connect remotely to the MacroPath via VNC applications. In this way, the pathologist can see the specimen in real time and, if necessary, guide and control a technician that can do this work and can orient and position the sample in the correct way. For example, now I'm not a pathologist and I prepared the sample with the correct orientation on the spatula. We will see later on why I prepared the sample on the spatula in the next video. After the gross evaluation, we can move to the second step, that is the freezing and the embedding of the sample. In the freezing step, the cooling down technique allows to have harder tissue that can be put in the cryostat and cut in few minutes. This allows technicians to skip the processing and embedding in paraffin that instead requires some hours, at least some hours. The freezing is the most critical part of the frozen section procedure because it determines if the morphology is maintained or not. In fact, the main problem during the freezing of a sample is the formation of ice crystal that lowers the quality. As you already know, the 70% of a tissue is water, and water has the physical property of expanding when the temperature is lowered, forming ice crystals that destroy or damage the structure of the sample, so they modify the morphology of the tissue. This distortion makes the diagnosis difficult. Look at the graph in the image. As you can see, water has enough energy to form a crystalline structure when it is between 0 and -5 degrees. To avoid the formation of ice crystals, the sample and the water in it must pass through this ice crystal generation zone in a very short time, less than 1 minute. A short freezing time, it's also important to reduce the overall procedure, of course. When frozen, the sample is also embedded, so it is important to orient the sample in the correct way. For the correct orientation, the specimen must face the area of interest determined during the gross evaluation by the pathologist. In my opinion, it will be easier and more correct if the sample to be frozen were placed face down, like in the paraffin embedding positioning. This is the easier way to have the correct orientation. Now, let's see which are the conventional ways of freezing a sample. The most common is the direct freezing in the cryostat. Then we have also the freezing in liquid nitrogen, dry ice, or cold isopentate. The first method, so the freezing in the cryostat, is the most simple and cheapest. But because the temperature in the cryostat can be too low, otherwise it's not possible to cut the sample, the freezing time in the cryostat is usually very long, and the formation of ice crystal is sure. The other three methods are not safe at all, because they are performed at very low temperature, -200 degrees for liquid nitrogen and -70 for dry ice and called isopentane. Liquid nitrogen also gives room saturation, while isopentane is also flammable and toxic. With all these methods, it's not possible to control the temperature of the block. The sample orientation is difficult and sometimes impossible. And the sample surface is not completely at the same level. So at the cutting, we need to lose much more time to reach the sample. Most importantly, despite the complexity and the risk associated with these methods, the final quality of frozen section is low. Now, I will show you another short video that helped me showing you our method to freeze a specimen. To improve the freezing quality, we have developed a new device that is called PrestoChill. This device has a working area with 6 metal molds at -40 degrees and allows to freeze the sample with a phase down technique, so like the procedure with the paraffin. This allows me to use a medium that is more liquid than a conventional medium. MCC improves the transfer of the sample into the mold, but also create the perfect connection between the frozen sample and the surrounding medium, avoiding the curling effect that we'll see later on in the cutting part. In the previous video, I prepared the sample on this spatula. Now I use the spatula to move the sample in the center of the mold. At this point, I can fill the mold with the medium, and if I want, I can add an identification tag to the block. I put the chuck that comes from the cryostat and it is tractor that enhances and speed up the freezing of the block. Only 30 seconds are enough to completely freeze the sample. But how does the freezing in the PrestoChill works? The direct contact between the sample and the cold metal at -40 degrees allow to have a freezing that is so fast that the water inside the tissue passes through from 0 to -5 degrees in a so short time that the water has no time to create ice crystals. It freezes in a vitreous way that is not larger than the liquid status. As you can see, this is the result. The specimen is correctly positioned in the middle of the block and it's all at the same level, making faster the trimming, of course. Moreover, there is the identification tag that allows to correctly and specifically recognize the block, especially if I need to freeze many samples simultaneously. Thanks to the phase down technique, the result will be of a very high quality with a preserved morphology without ice crystals. So now I can come back to the presentation for the other step, that is the cutting. The cryostat is the core instrument in the frozen section procedure. It is a microtome inside the cold chamber, so it allows to cut a thin section of the sample while keeping it frozen. Cutting is usually influenced by two factors. The first one is the temperature of the block. If the block is too warm, the section will be too thick and so not good to see under the microscope. While if it is too cold, the block will be more fragile and the section will break, giving the shattering effect that you can see in this image. The second factor that impacts on the cutting is the possibility of the tissue to roll away from the surrounding medium during sectioning. This happens because the cryo-embedding medium must be viscous to stay around the specimen during a conventional face-up technique. But this prevents it from correctly and properly binding to the tissue. A more fluid medium like the MCC that I showed you in the video before can help improving this aspect. The most advanced cryostats have some feature to try to overcome the cutting problems. They allow to change the temperature of the block holder in a very rapid way, but this is not enough to avoid the shattering effect if the block has been prepared at a very low temperature, like at minus 70 degrees or lower. In this case, you need to wait that the block ambientalize a little bit inside the cryostat. In addition, there is the anti-roll device that helps in stretching the section without the use of the brush. But this tool can't prevent the curling if the tissue is not correctly bonded to the surrounding medium. The real solution to both problems must be found not in the cryostat, but in the frozen method. And in fact, now I want to show you how is the cutting of a PrestoChill block in the cryostat. As we have seen, the PrestoChill block is flat and requires less trimming respect to a block prepared in conventional way. It is also easier to section because the surrounding medium adheres well to the specimen, because I used the MCC medium. During the sectioning, I don't have any shattering effect, because a short freezing of 30 seconds at minus 40 degrees in PrestoChill allows me to have the block at the correct cutting temperature for this type of sample. This sample is kidney and requires an ideal cutting temperature of minus 20 degrees. But with the PrestoChill, we can have a warmer or colder block. In fact, if I needed to freeze a more delicate sample such as brain, which is better sectioned at minus 15, 16 degrees, I can reduce the freezing time in the PrestoChill to stop the cooling curve earlier and have a less cold block, but anyway of good quality. On the other hand, in the case of adipose tissue, I can increase the freezing time in the PrestoChill to obtain a very cold block, which allows me to cut also fatty tissue that normally in cryostat is a nightmare. So with the PrestoChill, I can control also the final temperature of the block. Now I pick up the section and then I immerse it in the fine fix solution. As you can see, I put the section in a fine fix solution, so I can start the processing of the tissue of the thin section, which then will be completed in the Presto Pro unit, but we will see this in the next video. After cutting, we have the staining of the section. The staining of the section is fundamental in making the cell structure visible under the microscope. And also here, we have a space to further improve the quality of the result. Because also paraffin section must be stained, but in this case, the tissue has already been processed. So one way to improve the diagnosis of a frozen section may be to process the slide so that it is more similar to a paraffin section, which pathologists are more used to. Another good way to improve a frozen section quality is to automate and standardize the staining process. In most cases, in fact, the correct situation For frozen section, staining is a manual and an operator-dependent procedure. And the result is not homogeneous, poor in quality, and sometimes also faint. In this last video, I would like to show you the staining in the Presto Pro. Presto Pro is an automatic processor and stainer for frozen sections that is very easy to use. All I have to do is to start the program in the device, open the cover and place the rack containing my section on the arm positioning tool, close the cover and start the program. Now let's see inside the cavity. As you can see, the arm can move my section through the different staining steps. The first one is the immersion in heated fine fix. That is a special reagent that fixates, dehydrates, and clears the tissue. Due to the thin section and to the heating of the fine fix, the tissue undergoes a process in a very short time, in a few seconds. So at the end, it is very similar to a paraffin section that instead requires hours to get this result. After the processing step, the staining is automatic, freeing the technician to perform other tasks, and it is standardized. So the result is always the same, and it's not operator dependent. The Presto Pro allows to create different protocols in order to have the perfect balance between hematoxylin and eosin for each different tissue type. The combination of the technician's expertise and the automation of the Presto Pro gives the best result. In addition, Presto Pro controls the life of the reagent in order to not have never a faint result. At the end of the staining, I can take out the slide from the Presto Pro. I can cover slip it and pass it to the pathologist for the analysis under the microscope. And in fact, the last step is the diagnosis made by a pathologist under the microscope. Of course, the more the previous steps are improved, the faster and more complete and reliable the diagnosis will be. An improvement to this step can be a microscope that can be used remotely. In this way, and in connection with the use of the remote use of MacroPath, this allows a pathologist to make the diagnosis from another office or from another lab. There are many wall slide imaging and remote microscope systems on the market that can allow this job. In summary, in this webinar, we have tried to find improvements in all the steps of frozen section procedure. The gross evaluation can be completely revolutionized by using a dedicated system with a camera and a software that allows a secure documentation and also the remote control by a pathologist. Freezing with the phase down technique in a cold mold, so at -40 degrees, and with a more liquid medium, reduces the formation of ice crystals and makes the sectioning in the cryostat easier and faster. The processing of the thin section and the automation of the staining also improve the final results. Finally, we can use a remote microscope that, together with the remote control of the gross evaluation, makes it possible to carry out a frozen examination also if a pathologist is not physically present in the laboratory. I really hope that my presentation has been clear and interesting for you. And now I am available if you have any questions.
Thank you, Miriam, for your nice explanation. Now I have collected some questions. In the meanwhile, all the attendees are free to type as many questions as you want in the Q&A box so that Miriam can answer.
Sure.
Now, first question for you, Miriam, is this one. What is your recommendation for a lung section? Because of the air, it is complicated to obtain a section with good quality.
Yes, the presence of the air in the section can give a problem during the cutting in the cryostat. But thanks to the use of the MCC, because it is more fluid, it can feel better the holes created by the air. So also in case of lung, the much more fluid medium MCC can help having an easier and more complete section of the lung sample.
Okay, let's continue with the other questions. We would like to ask about fatty tissue. What temperature do you recommend? And also for brain tissue. So 2 questions for you. Fatty and brain.
In Presto Chill, it's possible to freeze all the tissue type, brain, breast, kidney, liver, all can be frozen at -40 degrees. What we need to modulate to have a better section of different tissue is the freezing time. For example, for a delicate tissue like brain, it's better to reduce the freezing time in order to stop the cooling down before the block reaches -40 degrees. We can stop it after only 20 seconds. In this way, we have a block that is only at -20 degrees, so at the perfect cutting temperature for brain. In case of breast, instead, is the opposite. We need to prolong the freezing time, and we suggest to freeze for 4 minutes because the breast is an insulation tissue in the body and requires a lot of time to get cold and became hard enough to be cut in the cryostat. So for breast, we have a specific protocol in which we freeze the sample for 4 minutes in the Presto Chill. Then we suggest to trim in the cryostat, but during the trimming, because of the friction with the blade and the warmer temperature in the cryostat, the block became warmer, and it is not anymore at -40 degrees. So in that case, we suggest to take the block, put again the block in the Presto Chill for 1 minute in order to have the best temperature for the cutting. Then, of course, we need to cut immediately. In the Presto Chill screen, maybe I zoom in a little bit. Just to show you better. Okay. We have, sorry, in the main screen, we have this icon that allows to open. Sorry, it's not. It's not focused. Camera. Maybe less zoom can. Camera. I'm sorry that I can't show you very well the image. Oh, maybe now. Okay, so we have this page in which we have 6 different timers, and we can set up the name and the perfect freezing time for each tissue type. So for example, here in my lab for brain, I freeze only 15 seconds. For breast, I do 240 seconds, so 4 minutes, and for kidney, 30 seconds. anyway, if the best way to see the result of the PrestoChill is to organize a demo. So you can test with your own samples and see the result with the different tissues.
Okay, moving on to another question about fixation. Can you please explain more about this and so also the fine fix?
Yes, surely. So to fixate frozen section, we use a fine fix that is a fixative that, because it's alcohol-based, it also dehydrates and makes a sort of clearing of the section. So after the fixation, the sample is not only fixed, but also it is like processed, so more similar to a paraffin section. Moreover, this reagent, the fine fix, is alcohol-based, so it doesn't contain formalin, that, as you well know, is cancerogenic. So this is less toxic and dangerous.
Okay, moving on to another question. What temperature and time is recommended for processing in fine fix? I think it's linked to this question.
Yes, yes. With fine fix at heating conditions, so at 37, 40 degrees, that is the temperature in which this reagent can act in a better way. With a section that is more or less 5 or 6 micrometers, the fixation time is 15 seconds. So it's very fast. Of course, with a thicker section, like in case of breast or skin, in which in some cases we need to cut thicker section, maybe it's better to increase a little bit this time. But anyway, maximum time is 30 seconds, about 30 seconds.
Thank you again. And now a question about which is the solution that you use for PrestoChill. So the MCC, but probably we already talked about that, or you can repeat a little bit.
The reagents that I use in the PrestoChill are the MCC for the freezing, because it's more fluid than the other compound. It has basically the same ingredients, but the composition is a little bit different, so it is more fluid, and it allows a correct movement and an easy movement of the sample from the spatula to the mold. And also the link between the tissue during the freezing is much better. Another reagent that we use in the PrestoChill is ethanol to clean the mold between two different samples. So before to do a freezing, we suggest to clean well the mold with ethanol, with the paper, and moisten it with ethanol, in order to avoid cross-contamination between samples, and also to avoid the presence of frost inside the mold. Other reagents that we use is for cleaning the instruments. So normally the working area, if there is a sample with a contaminant, it's important to decontaminate and clean the working area. We have a function in the system that allows to heat up the temperature of this working area in order to have it at the correct temperature, room temperature, for the cleaning, and any detergent can be used. We suggest to use Supraspore or ethanol 70% to decontaminate.
Oh, okay. Another question. What recommendation could you give us for skin in Mohs surgery?
For Mohs surgery, we have two different approaches. One is with the use of a disc, a round disc, in which we imitate the use of a slide that sometimes is used in this technique. And with the cryospray, we can fix all the margin of the sample to the glass and then transfer the glass inside the mold. Then we add the medium and we create the block. At the end of the freezing, we need to heat up a little bit the glass in order to remove it from the block. But in this way, we have a perfect flat block that is level with the chuck. So in the cryostat, it's easier to position it correctly. Another, the other protocol that we use is to have, sorry, I need to take these tools, okay, is to put inside the Presto Chill a flat surface like this one. And when it is at -40 degrees, it's possible to put directly on it the MOS sample, the skin sample, and push down all the margin in order to have all of them at the same level. Then we use this ring to create a sort of mold and of side around the sample. We fill with the medium, put the chuck, and we create the block. At the end of the freezing, of course, the block will be linked to the ring, but we can use this tool to easily push down the ring and pop up the chuck from the inside of the ring. So both methods give a very good result, because the freezing at -40 degrees allow to have a very good result. And the best way to understand which is the most helpful, the most correct protocol for you in your own lab is to do a demonstration. So in this way you can try both methods and understand which is the best one for you, because it's sometimes it's a personal impression.
Thank you, Miriam. One final question about the Presto Pro. How many slides can you process in Presto Pro, and how much time do you need?
Okay. In Presto Pro, we can insert this rack in which we can put up to 6 different slides. Moreover, in the Presto Pro, we have an arm with a double position, so we can work with 2 racks, so 12 slides simultaneously. About the time, the standard protocol in Presto Pro are 2, and one is long 4 minutes. The other one lasts 2 minutes and a half, 2 minutes and 20 seconds. What I suggest is during a demo or in installation to try both programs, because the results allow you to understand how to modify, if needed, the program, so you can then create a new program with the perfect time and the perfect results for your lab.
Thank you, Miriam. Thank you for all your answers. Now time is running out, so for all the questions that have not been answered, for sure we will reply via email in the following days. Now let me share with you one final slide where you can see our contacts. So feel free to contact us if you need any additional information from our side, or if you want to customize a virtual demo like Miriam said before, because our specialists can customize the demo according to your needs, to the need of your lab. Finally, I would like to remind you the dates of our next webinars. We will have one webinar in April, and the topic is tissue processing, and then in May, and the topic is crossing station. So keep following us on our website or on our social network to stay up to date. Tomorrow you will receive an email message with the webinar recording. Thank you very much for watching and participating, and we hope to see you all next time. Thank you and goodbye.
Thank you very much. Bye-bye.